Are you one of the many individuals who experiences persistent acid reflux, sometimes called GERD, even after trying lifestyle changes and medications? If so, you might have heard your doctor mention a surgical option called fundoplication, a procedure designed to strengthen the valve between your esophagus and stomach. Fundoplication refers to a group of surgical procedures aimed at treating severe acid reflux by reinforcing the lower esophageal sphincter, the muscular ring that normally prevents stomach acid from flowing back up. The main types of fundoplication are Nissen fundoplication, Toupet fundoplication, and door fundoplication, each differing in how much of the stomach is wrapped around the esophagus. The reason for these different types lies in the degree of wrap around the lower esophagus. The goal is to create a stronger barrier against reflux without causing too much tightness, which could lead to difficulty swallowing or gas bloating. A Nissen fundoplication, also known as a full fundoplication, involves wrapping the upper part of the stomach, called the fundus, completely around the lower esophagus. This creates a 360-degree barrier. This full wrap is highly effective for stopping reflux, but in some patients, it can sometimes lead to side effects such as difficulty belching or vomiting, or feeling bloated after meals. To address these potential side effects, partial fundoplications were developed. The Toupet fundoplication involves wrapping the stomach partially around the back of the esophagus, typically for about 270 degrees. This still provides a strong barrier against reflux but often allows for more natural swallowing and belching. The door fundoplication is another partial wrap, usually involving about 180 to 200 degrees of the stomach wrapped around the front of the esophagus. The choice between these partial wraps often depends on the patient's specific anatomy and the surgeon's preference, as they both aim to reduce reflux while preserving more normal physiological function. When considering which type of fundoplication might be right for you, your healthcare team will conduct a thorough evaluation. They will review your symptoms, perform diagnostic tests like endoscopy and esophageal manometry, and discuss your overall health. These tests help them understand the exact nature of your reflux and the function of your esophagus, guiding the decision toward the most appropriate surgical approach for your unique situation. The aim is always to restore comfort and quality of life. An interesting detail about these procedures is their evolution. While the Nissen fundoplication was first described in the 1950s, partial wraps were developed later to fine-tune the procedure, offering more tailored solutions based on individual patient needs and minimizing post-operative complications. This illustrates the medical community's continuous effort to improve patient outcomes and comfort after surgery. For instance, the 270-degree Toupet wrap is often favored in patients with less severe esophageal motility issues, as it is thought to be less obstructive than a full Nissen wrap. Understanding the different types of fundoplication empowers you to have a more informed conversation with your doctor about potential surgical solutions for persistent acid reflux. By knowing the distinctions between full and partial wraps, and how each aims to reduce reflux while balancing other bodily functions, you can better appreciate the personalized approach your healthcare provider will take to help you find lasting relief.